We have access to treatment centers. Do we have enough? I don't know. We have access to beds for folks and housing for folks. Do we have enough? I don't know. If we're not resolving for addiction, we'll never resolve for the deaths.
Frustrations from a Baltimore City councilman over the handling of the opioid crisis reaching a boiling point. Some new details now in an 11 News Investigates exclusive. Chronic pain, Maryland's opioid crisis. Baltimore City Councilman Mark Conway says opioid overdose deaths may be the single biggest issue facing Baltimore right now.
But as the city begins to collect hundreds of millions of dollars from lawsuits against opioid manufacturers, Conway says people are waiting for help.
Investigative reporter Tali Taylor joins us now live. And Tali, his biggest critique here is directed at Mayor Brandon Scott.
Yeah, in Baltimore, it's the mayor who holds the power. And Mayor Scott says his legal team has advised him to wait for all the opioid lawsuits to be finished before announcing more details for the money. But Councilman Conway says with the opioid death toll over the last couple years, there's no time to wait.
When I came in here, I was a heroin addict.
After a multi-year battle with addiction that began when she was just 17,
I knew that I couldn't go back to Southwest Baltimore because I would die.
Bree Bain was taken to One Promise, a Baltimore treatment center.
I got married in recovery, and I had a baby, so my baby never has to see me use.
From a patient in recovery to one of its employees. But she says in recent years, there's been one big change with those she helps: fentanyl.
It's so dangerous. I mean, you don't even get like a chance to get Narcan. Like, you just die.
State data backs it up. Last year, of the nearly 1,000 overdose deaths involving opioids in Baltimore, nearly all of them came from fentanyl.
Some of the Narcans don't even work.
As community organizations and treatment centers wait to hear where nearly $669 million from city lawsuits against opioid manufacturers will go, the mayor's spokesperson says the city hasn't yet received the vast majority of it, though all of it will be in hand within the next 2 years. Meanwhile, more than 2 city residents are dying each day from opioid overdoses. Still, some worry when the time comes, the process for distributing funds won't be transparent.
This money should be put through a competitive bid process.
Craig Lippens works alongside Bain at One Promise, while also serving as the president of the Maryland Addiction Directors Council, a nonprofit that advocates for centers treating substance use disorder across the state.
The vendors should be vetted, and there should be, in the best case scenario, outcomes that are measurable that show improvements in public health in Baltimore City.
For the 22 city organizations receiving $87 million that were named in the settlements, the city says it's working with them to make sure the use of those funds meets best practices. If the money is spent the right way, Lippens says it could create real change for city residents.
I think that the pervasive theme behind the violence and the petty crimes in Baltimore is drug use and drug dealing.
He says a portion of the city's new funds should go toward creating additional treatment centers for men and women with children and to establish additional adolescent opioid treatment programs.
Baltimore has an opportunity with $500 million to innovate and become a leader.
Baltimore City Councilman Mark Conway wants Baltimore to become that leader now.
We should be working with all the urgency we possibly can to address this issue.
Over the summer, Conway tried to hold a series of hearings on the alarming number of opioid overdose deaths in the city, but was blocked by Mayor Brandon Scott, citing pending litigation. Why did you call those hearings?
So you have to first understand the problem. I really wanted to hear from our first responders, the fire department and EMT and EMS, our police department, and of course the health department.
Why is this issue in particular so important to you?
I feel like I have a responsibility, and I would suggest that this is one of, if not our biggest issue right now as a city.
Conway applauds Mayor Scott for deciding to take on opioid manufacturers individually. The city's reward, nearly $669 million so far from those lawsuits.
I am grateful to the jury for seeing the truth.
The mayor's executive order in August established a restitution fund and an advisory board to oversee the $669 million, with 180 applications received and interviews scheduled to happen this month. But a spokesperson writes that none of that money will be dispersed until the new year. And Mayor Brandon Scott says pending litigation prevents him from providing more detailed plans publicly.
I understand we're in the middle of litigation right now, but if we're not talking about it, we won't get there, and another year will go by, and we won't make substantial changes.
Mayor Scott has declined our request for a sit-down interview about this, dating back to September. But the mayor's spokesperson writes that staff are working on a coordinated strategy for city agencies and community organizations, working to prepare for when the influx of cash arrives. Adding in part, simply put, the administration is less concerned with what Councilman Conway proclaims he needs than we are with what the residents of Baltimore need. In December, the city heads to an abatement trial where the goal will be to recoup billions of dollars in additional funds.
Hopefully it goes into the right hands of the right people that make really smart decisions to save these people's lives.
The mayor's spokesperson, Brian Doherty, writes that all of Councilman Conway's questions were answered during the recent public trial. Following the abatement trial in December, Doherty says community engagement efforts will begin.